Thank you for your patience. Let us now begin the first panel discussion, titled How Healthcare Startup Ecosystem is Shaping and Influences the Country's Health System. This session will be moderated by Dr. Buzz Palmer, Chief Executive Officer, MedTech Actuator. Joining us on the panel are Ms. Carla Gerlach-Perron, Chief Medical Officer, Philips; Ms. Kei Makishi, Vice President, Lupoff Stevens Family Office; Dr. Joseph Damian Markanu, Managing Partner, Verge Health Tech Fund; and Mr. Chris Sawyer, Innovation Lead, Digital Health Innovate UK. Now, without further ado, Dr. Palmer, over to you.
Great. Good afternoon, everybody. Thank you so much for attending this panel session. It's a really exciting panel session, and we're going to dive into this kind of intersection around how innovation and ecosystems come together. How do they work? How do we think through it? How is healthcare enabled with innovation and ecosystems? How does insurance play a part? What does an ecosystem do? And are organic ones better than pre-designed ones? It's a really interesting concept. If we look around the world and we look at this new age of healthcare, we look at how healthcare is developing. We're on the precipice of a 100-year change in healthcare, and it's an amazing time to be involved in it. But how do we think about that? How do we build the capability, the skills to make sure that this next generation of healthcare technology, it really fits exactly how we imagine the world to be? I often say that we can sort of sit around and wait to see what happens, or we can be part of the conversation. Be part of the conversation, design the future that we want it to be. And so I'm really excited today to have an incredible panel of experts from around the world. So we're going to talk about how innovation ecosystems happen on a global scale. How should we think about it? And how do we, here in Japan, work out, how do we position ourselves to be a real incredible ecosystem that offers global innovation around the world as well? So thank you, panel, for joining today and having this conversation. What I might do is I might invite you just to give a 30-second overview of who you are, what you do, and where you come from. Thank you. I might start with yourself, Carla.
Yeah, thank you very much. And thank you for the opportunity. First of all, Carla Perron. I'm the Chief Medical Officer for Philips, which is a big corporation with 134 years of history and in innovation in many different areas. I'm a gynecologist by training, Brazilian American, and recently living in the Netherlands, so very excited to be here to kind of discuss a little bit how we can influence innovation and how we can transform healthcare to support more patients.
Thank you, Buzz. Thank you, Carla. Hi, everybody. My name is Kei Makishi. I serve as Vice President for Lupoff Stevens Family Office, which is a single family office based in New York City, started by a former hedge fund manager, Peter Lupoff. And we invest across all asset classes. I diligence our venture investments, and our thesis is around impact-oriented VC funds and founders. I'm happy to kind of dive into that as we have the discussion. But basically, we're investing in anything that positively impacts people and planet. I'm Japanese American. My parents are both from Okinawa, based in New York City. My background is I'm a former founder, operator, did VC, and now diligencing LP investments. Separate to that, I also advise the Tokyo government on developing their venture ecosystem. So extremely excited to be here and looking forward to the discussion.
Hi there, I'm Joseph, co-founder and managing partner of Verge Health Tech Fund. So Verge is a global VC fund. We invest very early stage, so first check, preferred stage is seed, in anything that can move the needle for millions of people using technology in health. This can be things like lightweight, clinical grade IoT devices, point of care diagnostics. It can be reverse innovation, so taking complex machines that live in hospitals that can now be used at the GP for a fraction of the cost, or also platforms like electronic health records, digital disease management, remote patient monitoring that can reach and impact millions of people. And we've done this now for 7.5 years, invested in 30 companies, impacted over 24 million lives in the process. And we've invested across all 6 continents on Earth. We hope to invest in Japan one day. So if anyone here has any really good ideas that can move the needle, very happy to. Personally, was born in Romania, grew up in Canada, based in Singapore for the past 11 years, former entrepreneur, scientist, and management consultant. So please don't hold that against me.
Yeah. Hi, everyone. Great to be here. Chris Sawyer, lead on digital health at Innovate UK. Innovate UK is the UK government innovation agency. My background is 25 years in the medtech industry. Also spent about 6 years working with the NHS, working with the innovation hubs, looking to work with clinicians to develop ideas and turn those into commercialized products. Great to be here.
Wonderful, thank you. So Chris, you've got the floor, so I might start the first question with you. So you're based in the UK. We know that the NHS is a sort of central management system for healthcare across the country. And Innovate UK leads efforts to create innovation and to really kind of push the agenda. Can you give us some examples of how this has worked in the last few years since you've been involved?
Yeah, well, there are probably many examples I could use. There's from the grant funding side, so there's collaborative R&D, for example. So if I point to one which is really close to my heart, I led on the Digital Health Technology Catalyst, which was a £35 million program, part of the Industrial Strategy Challenge Fund, which was really focused on collaboration. So it was SME-led innovation, working in partnership with a number of different organizations, but one of the key organizations was the NHS. And the NHS was a key development partner. So it wasn't just working on the clinical stuff, but it was also working on design. So it's not just the design of the technical solution, it's also how it fits into that pathway. And you can look at it also from the development, but what I also look at is, we talk about £35 million investment, it's quite a sum of investment, but it's about impact. And the impact here is that we had businesses in that program that had 4, 5, 6 employees, and then within 1 or 2 years after the program had finished, had 98% penetration rate in the NHS, and had grown from 8 employees, this one company in particular, had gone to 250 employees. And then also, some of the businesses also had international penetration as well. So that is just an example of how working in partnership can be very effective in helping products make its way into the marketplace.
Yeah, amazing thing. It's a really interesting concept as well. I think the kind of the central system, the drive, the pull of the marketplace. And Joseph, I might move to you because you're based in Singapore. And the government plays a huge role in kind of designing some of these initiatives in a very short amount of time compared to the UK. What sort of approaches have you seen in Singapore that differ to the UK, and what approaches have you seen that are really effective?
That's a good question, and I have to guard my words slightly here. So I think Singapore certainly has the resources to heavily invest in something it believes in. I think what is particularly unique to Singapore is that you've got this kind of competitive dynamic even within the public health system, and I think this goes back to the founding days of when Lee Kuan Yew was basically, and his pioneering team was setting up the country, and that they actually set up different clusters, and they wanted there to be a bit of competition between the clusters, so they encouraged them to be more competitive than collaborative. And I think that was appropriate for the time, but sometimes you see a little bit of ripple effects going forward. Now, the 5 clusters are now consolidated down to 3 clusters, but you do tend to see efforts that are a little bit, I'd say, replicated across the clusters, when in fact probably they should have been unified across the clusters. I think that's one thing. There is a very healthy ecosystem for supporting innovations that come from physicians and academic scientists, and I think based on their experiences of seeing other, I'd say investigator-led innovations, they've kind of copied that model quite effectively. I think there needs to probably be a little bit more emphasis on private sector-led innovations, although they do have government-led programs from Enterprise Singapore, for example, that would give granting and early financing for that. So I think that's one dynamic, and it's also probably arising from the fact that Singapore is a uniquely mixed payer system where it isn't one single payer that's responsible for everything. They believe in avoiding moral hazard and sharing responsibility. So there's always a component of private funding, or rather the copay that comes out of a medical savings account or out of pocket. You've got your public financing, and you've also got, in case all that exhausts, you've got the actual treasury that can fill in as an emergency stopgap if the means aren't there and it's assessed that you are in need. So it's interesting to see that shared accountability and how that kind of plays on the psychology of how healthcare innovations are designed and commercialized. The other interesting thing about Singapore is that the Singaporeans know that their market is small. I mean, there's only 6 million people in the whole country, of which only 3.5 to 4 million are actually citizens or permanent residents. However, you have 680 million people in your backyard, and you know, as sometimes politically contentious as the statement may be, Singapore is kind of seen as the shining jewel. It's kind of seen as the highest quality, the safest, the most reputable. So a lot of entrepreneurs flock to Singapore. They set up their companies in Singapore for playing something a bit more regional in nature. How much of that is organic versus designed, I think is a little bit calling into question. Certainly you have government scholarship initiatives that try to attract the best and brightest students from the region to come study in Singapore schools, give them support, financial support, as well as academic support to try to make a life in Singapore and stay there and contribute to making the country better, which has downstream effects in entrepreneurship. I don't know if I'm being too vague here, so you can dig deep. You can say, hey, is there something more that you want me to dig in here?
I'll dig deep in
yeah,
the next few questions,
yeah.
for sure. But Kay, I might come to you. So putting your US hat on. And so we know that the US healthcare is vastly different to certainly the UK and to Singapore. And that the innovation drive is predominantly private sector developed. And so with the US kind of leading global innovation in healthcare, what are the challenges or trade-offs that come with that model?
Great question. And just to kind of piggyback off of what Joseph was saying with the different clusters and redundancy, right, with the different clusters. So I think it's always a double-edged sword, right? Where challenges are, there's also opportunities. And I think if I were to summarize it with one word, it'd be fragmentation. A fragmentation of the market, fragmentation of the multi-payer systems of different hospital markets, right? Effectively, there are different regions in the US, and that can be frustrating in terms of scaling if you're a startup, but then that's also where the opportunities lie. I'll talk more about the private market side because that's where I spend most of my time diligencing venture funds and opportunistically founders and individual companies. But I think there's definitely opportunity in the niches, I would say. And it is, is there experts that really, not just subject matter expert, but then compare that well with commercialization? So that's where I see where a lot of the winners are, is not just understanding the technical side, but pairing that with the commercialization and the regionalization and being able to go to market. That's where I think there's opportunities. But again, that also, there's kind of a tail of that where the fragmentation then kind of hits a wall in terms of scaling, right? And so I think the real winners again are in sort of these tail end emerging managers. I see kind of really developing different technologies and IP that isn't in the mass market. Obviously, that's where the innovation comes from. But yeah, that's kind of high levels of fragmentation, I would say.
And can I just add one element to that? How, with the insurance system in the US, which is incredibly complicated in so many ways, and Carly might have a thought on this as well, how does that affect the competitiveness of innovation coming through the system? So in the UK, we're driven by government. In Singapore, predominantly government, a little bit of kind of personal contributions as well. But in the US, it's predominantly health insurance. Is that an advantage to the system? Yeah, please, Kay, and then maybe Carla.
It's what I call, I think, invisible infrastructure, and part of the entire venture ecosystem in general, where LPs can be value add, where VCs can be value add to the founders as well. Just before this, I was talking to a payer friend of mine who's here, large healthcare insurance provider in the US, about a lot of working for the GPs, on behalf of the founders through the GPs, by getting the portfolio companies into these larger systems in a way that is win-win-win for everybody, right? Win for obviously for the founder, for the GP, getting the new product or service into these actually large kind of more behemoth infrastructures, I think can be helpful, right? Because there is multiple payers, so everybody's kind of competing for that edge in product, the edge in their larger corporate innovation. But again, it's always a double-edged sword, because with the larger corporations come larger lead times, more bureaucracy, harder to kind of get into those doors. And so that's where I think every time we talk about venture, we really need to look at it from a holistic view and not just kind of a point solution hat, which is, oh, here's the founder, here's the VC, here's the corporate, here's the government, not siloed, but how can we systemically invest together and to actually create innovation towards a system that is patient-centered and actually bringing value. So yeah, just to summarize with your question about health insurance providers, yeah, I think they can be, if you have to find the champions in the larger systems that actually care and can move the needle. And I think that's really the trick, is in any larger institution, right, whether it's government or health insurance companies, is who's the person that actually cares and is aligned with the vision, whether it's a vision of the GP or the company, and then really kind of partnering with them. It doesn't have to be an official partnership, right, but sort of mental kind of thought leadership with each other. And we need everybody, right? There's stakeholders across all the entire ecosystem stack that you need to identify and truly partner with to get innovation into these systems and really help these companies succeed.
Yes, I mean, you talk about systemic innovation and collaboration and partnerships and investment there. And Carly, you've got a unique perspective from 3 jurisdictions, from Brazil, from the US, from the Netherlands. From your perspective, and both have very different approaches to healthcare, to innovation as well. Between the 3, what are some of the most beneficial elements of each that you would pick out as winners or as gold standard models of innovation in an ecosystem?
That's a great question and a tough one to answer in a short period of time. But I would say the success of partnerships, in my view, resides on one word, which is common goals, right? I think just building up one of Kay mentioned, you need to find that person that really becomes your advocate around patient centricity and where the value is. So when I think about comparing those 3 healthcare systems, Brazil has a universal care type of system. 75% depends on the public healthcare system that is completely for free, which means you need to support the basics. But then from the company perspective, the innovation, the market opportunity resides on the 25% with the private market, right? While the US, as well said here, it's the largest market on the planet, and where the most opportunities are also big challenges because it's very fragmented. In the Netherlands, we have a very unique situation. It's also a combination between public and private, but everybody gets a universal coverage that is it's offered by private companies but defined by the government. So it's very transparent and very easy to manage innovation. But then you have the challenge of how do you scale outside of that environment. So say those 3 healthcare systems are very different and very unique. But they all offer, and in my view, a unique perspective of what kind of innovation you can drive forward. And how companies like Philips, for example, can partner or use the specificity of each of the healthcare system to be successful. So we do have today partnerships happening in all those 3 environments. Definitely more towards partnership with local NGOs in Brazil, where they know how to navigate the system pretty well. In the US, those big corporations, right? It's almost impossible not partnering with the big universities over there. And definitely having the FDA behind and supporting the needs of the FDA is a critical point in any successful innovation from a company the size of Philips. And then in the Netherlands, absolutely the massive opportunity to partner with very good institutions, universities, with a regulatory agency and a government that is very open to support public and private partnership, where you can get innovation out of the door very quickly. So I don't think there is really one size fits all, but definitely an opportunity to explore different scenarios in how you can get there faster.
Philips is a kind of an interesting story in many ways, and Eindhoven itself. And so we recognize that for a successful ecosystem to really flourish, you need good government long-term policy, you need strong academic capability, and you need the private market to pull. And in Waterloo, in Canada as well, with the BlackBerry, and of course in Philips with Eindhoven, you find that smaller companies gather around those larger organizations and with the government support to kind of drive innovation. It's been extremely effective in Eindhoven. But what about innovation ecosystems that don't have all three naturally? Is there a way that you can still create strong innovation? You talked a bit about scale up as well. We know that it takes 35 to 40 different skill sets to commercialize a medical technology. So organically, we know a little bit about that. But can you design when you're missing some of the crucial bits?
Well, I'll start and then please chime in, right? So in my view, there is definitely an opportunity for you to design and kind of like define what are the pieces that are not naturally or organically there. So I think the Netherlands and Eindhoven is a great example of having the university that are also onboarding and supporting small startups that are adding to what is missing in that game. There is the government, there is corporations like Philips, but then you may not have the pull from the market because it's too small, right? And so how can you bring that perspective from other countries, creating international partnerships, organically organize, structurally organizing that, right? So pooling hospitals from the US, from Asia, from Europe together, I should think about developing and validating technology that can be scaled. And then that ability to scale can happen through companies like Philips or other partners. So I think it depends on what kind of technology you are thinking as you are innovating. Today, more and more, we talk about AI, right? We talk about software as a medical device. We're no longer innovating as we saw 20 years ago, where we were just focused on the final product, the IP, and the ability to manufacture and commercialize. We're talking a lot about cloud-based solution, right? Things that may be very simple, but back to, I think, what all of you mentioned, improve access to care, that can bring more patients into the funnel, that can solve problems that we're all trying to fight against. We don't have enough staff, right? We don't have enough hospitals. We don't have enough funds to support the fact that the population is also getting old. So I think there is a lot of different aspects of it that can be structured as an additive to what happens organically.
And Joseph, you must have some comments on this.
I do. I've given this one a lot of thought because we do invest globally and we kind of see some recurring patterns in places where you have a rich, innovative environment and where you don't. I think a lot of countries have a propensity for invention rather than innovation. So, for example, both Singapore and Japan have in common the fact that some really good intellectual property and science is being done at the universities. There is also a commonality that there's a lot of money, there is a lot of long-term thinking, and there's a lot of execution ability. What is missing, at least I can say in Singapore, is the risk tolerance that is needed in order to start a new venture. You might as well, I should say, you might as well commit seppuku if you fail in Singapore, right? There's a very low tolerance for failure, especially from the same sort of institutions that pride its academics. And it's interesting, the failure-tolerant Singaporeans are the black sheep of the family. They're the ones that had to go to Polytechnic or didn't go into the best schools. They had a necessity, and then the necessity drove them to the innovation. And so you kind of have this psychological or attitudinal mismatch between the high-end innovation and the risk tolerance that needs to take this all the way through. So you can make a conscious decision. You can say, we're going to embrace the startup ecosystem, but we need to train our people to tolerate failure and to be passionate about the problem enough, or find that person who's passionate enough to take that big risk, disproportionately to where in the US, failing is like, going out and, seeing your friends, right? It's something that's part of life. It's okay to fail. Or in other places like Israel, it's okay to fail. Or in Eastern Europe, it's okay to fail because, you have no choice. So South Africa, it's okay to fail. You have no choice. So I think that's the key thing. And if you realize that, okay, we don't have the tolerance for failure and we'll never get the tolerance to failure, then it's about corporate innovation and licensing. It's not about startups. And that can be a very conscious decision that you can make to say, you know what, we're going to do entirely like problem statement based, ideation, and we're going to find people that are going to make a very stable salary in order to systematically solve this problem. That's one way of doing this, and it's a perfectly legitimate way of doing this. But if you're going to go for this whole startup nation, you need people that are willing to do startups and are willing to fail and are willing to, give 110% and not be shunned by society if it doesn't work out. You pick yourself up and you do it again. Now, one interesting thing, and this individual will remain nameless, but he got around this innovation challenge or this founder challenge by importing Israelis. So he would basically, and this is a Singaporean fellow, but he would do venture building, and for every one of his life sciences companies he would spin out or found or license out, he would import an Israeli CEO. And that was his particular way to do it. It's not necessarily super scalable, but that was his short-term solution to try to solve it. If I can't find someone who's not afraid of failing, then I've got to import that talent. Not sure that's something that will work at scale or be politically palatable.
Okay, I think you had a comment.
Yeah, just to kind of build upon what you were saying about the culture. So I think it's two things. I'll answer from a US and Japan perspective and sort of the difference between both, and very different markets, very different culture, and then also market access, right? The total addressable market. And to Carla's point, eventually for companies to scale, they do need to access a bigger market, and oftentimes that's the US or global. So agree with that point, and also I'll answer from more of a macro standpoint of asset classes. So venture as an asset class isn't as developed, let's say, as other asset classes, right? Like hedge funds or private equity. So I do think it's fairly, in Japan too, it's still developing. And also it hasn't had that time for the virtuous cycle of venture, meaning the time for founders to really have successful exits and then reinvest that capital back into future founders into creating their own funds. Specific example, I'm diligencing a fund right now, a healthcare life sciences fund, where the founder and CEO put 20 million of his own capital into kind of kickstarting the fund, right? When I look at funds in Japan, I don't see sort of that level of example, let's say, right? And that level of commitment, just because it hasn't had that sort of life cycle of being able to kind of have that successful founder. So totally agree with that. And given sort of where the Japan market is, it is where can you be intentional in design, right? Not just organically, but actually, I think what Japan is really good at is bringing in kind of government stakeholders. And I do see a lot of effort. I worked in Japanese government over a decade ago. Compared to then and now, I do see a lot of concerted effort in actually making this really kick off, right? Innovation at large, but also in the life sciences. And I think each country and each market needs to think, what is our strength in the global context, right? I don't think everybody needs to copy the US market or Silicon Valley or Boston or SF or New York. It is what are our strengths? I think in Japan, there's a lot of opportunity with deep tech in the IP that you were talking about. I think where they can improve is in commercialization and access to these markets. Something that I'm working on too is how do you systemically create commercialization opportunities and partner with where the IP originates, like the universities or in large corporations, to your point, right? A lot of it kind of gets stuck in that bureaucratic, large, machine. How do you kind of cherry pick that and then create companies around it, commercialization, to your point about maybe CVC is the right way, and I agree. There's different types of innovation. Not every type of innovation or success story needs to be sort of that unicorn founder created it, exited, took the company public. So I think it is really what is the, what are the pros and the strengths? What is the wedge that a country or that individual, just like any kind of founders assessing a company, as kind of to stay on this topic of country health systems of a country, what is the country's strength? Where's where does the talent lie? And then what are the gaps and opportunities where you can partner with other countries, right, or other kind of stakeholders, whether it be governments or corporations, to be able to fill in those gaps. And so that's where I think, yes, and it's organic, but you can be intentionally organic, right? And laying the foundation in those frameworks, and then and letting the relationships and partnerships grow organically. But I do think, there needs to be a little bit of both. And I know that's maybe kind of a cop-out answer or very, very high level, but that's kind of what I'm seeing across the US and Japan.
So I'm going to pull out a few comments in just a second, but I'm going to let Chris just speak on the UK's perspective on this.
Really, not particularly talking about the UK, but I think partly, kind of what you're kind of alluding to is, I think part of what we're missing here is about the strategy and planning. And it's a long-term strategy and planning, whether we're talking about countrywide or regional. But it's ensuring that you've got kind of the flow through the pipeline of those skills which are necessary to be able to build these different industries. Because without the flow through of those different elements, then you're not going to be able to build those businesses in the different regions of the country, which will then give you that opportunity for economic growth. So if you don't have those things in place, which is basically kind of the building bricks in place, you're not going to be able to have those businesses which will enable you to exploit those opportunities. So the market stuff is one thing. So businesses can have their go-to-market strategies and all those things, but you need to have all those other things in place to be able to take advantage of those opportunities.
And with the UK specifically, the UK is a fairly advanced market in many ways, but you've got a single sort of pool of innovation, which is the NHS, and it's weakened over the years. With the startups that you see, do you see them thinking global from day one? Do they go, no, we're going to US, no, we're going to go UK, actually we're going to hit the Netherlands or Singapore? How do they think about this globalization? And if there is no skills or there's limited skills available for the UK marketplace, do they search for them elsewhere? How do they think about that ecosystem growth and that commercialization development path?
Yeah, NHS is 3% of the global market. So, there's only so much room for, the huge number of businesses in the UK that are developing technologies. So, it's not an easy market to sell products into, and it's hugely competitive. So, businesses are looking at, other countries. We run global programs as well, so we're supporting businesses to take a look at those the different markets and so forth. And the businesses that we support, their go-to-market strategy is down to the business. We're not advocating you have to go to the NHS to sell your products to. It's down to the company to determine what where their opportunities are. We support the development of technologies. And the assessments of those technologies is partly down to the business opportunity as well. So, we 100 support businesses that are looking at global opportunities wherever those opportunities may be. And it has to be aligned to their technology. And, we're supporting the development of medical technologies or medical solutions in all parts of the market. And they're not all going to be sold to the NHS.
So Carl, I might just ask you, so with something like the Netherlands and Philips, which is both a private and public concept, I assume you see lots of startups globally moving towards the Netherlands because of organizations like Philips. Is that a sensible move for them? Is that the right ecosystem for many of the startups? I mean, to Chris's point, we know that startups will usually choose the biggest market without really understanding the niches of this market, the reimbursements, the regulatories, the payer models. They don't think that they go for the biggest markets. Or they'll target where large corporates sit and play, and they might be an acquirer for them. Do you see this happening in the Netherlands? Do we see UK companies or Singaporean companies heading towards your direction?
I think the short answer is yes, but they are still a little bit skeptical, right? How this will work for future state. You mentioned two things that for me are critical, right? So it's the regulatory environment and the reimbursement. I think one of the things, if I look to the name of our section, right, how the startups ecosystems can influence the country healthcare system, this is a critical one for me. Because the startups do have the ability to come with innovative ideas and to fail fast, which big corporations are not with that same appetite. But they are also exploring what is a regulatory pathway, right? And right now we are innovating in areas that we do not necessarily have a very prescriptive regulatory environment, specifically if it goes software as a medical device. It's new, right, for every single country in the world. How much can we leverage that approval from one country to another country? The other piece is the reimbursement. We're still innovating today with the same mindset because it's the only model we know, right, that we had from the reimbursement perspective years ago. And some of the amazing solutions I've seen and Philips has been investing on are not necessarily going to lead to different specific outcomes that can lead to additional reimbursement, which is a traditional model of go-to-market strategy. So how much can we disrupt the reimbursement, I think is critical. In a country like the Netherlands, that may be easier than others because of the way that the healthcare system is organized. It's universal, it's beneficial for everybody, it's small, so you can always change things faster. How much that can be scalable to a country like US or Singapore or UK, it's still a question mark. So I think we're starting to see more movement from companies kind of starting from where it's organically there or where the opportunity are easier for even for you to maybe fail fast, because that's another advantage of the startup, which big corporations don't have appetite to, right? They want to know return of investment, and same for the capital investment overall. So I think the future of the innovation will reside on that big partnership with regulators, and the ones that come with a more friendly approach will definitely open up the market. But also, how can we disrupt the traditional reimbursement pathway that exists today? Because some of the innovations that are coming to the table are so new and so innovative that they don't actually fit into the reimbursement pathway that already exists.
And Joseph, Mike, with your investor hat on, talk to you a little bit about, so we talk about software as a medical device, we talk about reimbursement, we talk about regulation. We're kind of venturing down a new path that maybe none of us really know. And we're seeing lots of different variations of payer models, of business models. We're seeing a much stronger community pull as well, this kind of consumer element of e-commerce and health tech as well that we're seeing in this space. How do you think through that? If a startup comes to you, I want to go to the US because they're a big market, or I want to go to Australia because they're a higher paying market. How do you think through that with these new models coming through?
It's an excellent question, which we challenge ourselves with, constantly. There is a bit of a false start with COVID, where we suddenly had to invent new ways to deliver care as well as pay for it. And I think there were some major regulatory and policy changes as a result of this, and the corpses of thousands of health tech startups that paved the way there. People realize that yes, innovation may eventually happen, but not in the timescales that you expect or is within your fund lifetime. I think the universal theme across all of this is evidence, and I think a lot of startups had thought, hey, we're going to just do something and not gather the requisite health, economic, and clinical evidence that would support someone paying for it one day. And they ended up, getting a lot of initial traction because, of course, as a VC, if you pay your startups to go then acquire customers for free, then you'll get something, but it wouldn't be sustainable necessarily. So now we kind of look at, well, okay, who are the stakeholders that would benefit and have the risk tolerance and deep enough pockets to benefit from something like this were it to come to fruition? And usually the first port of call is pharmaceutical companies, because they have the most to lose if governments and private payers decide to stop paying for their drugs. And some of those drugs are $400,000 a year. Even, they would say if you gave GLP-1s to everyone who needed it, you would basically bankrupt the planet. And you already see Novo Nordisk, maybe the numbers aren't as new as they are now, but it's, Wegovy is 14% of Denmark's GDP, right? One drug. One drug is 14% of Denmark's GDP. So they have the deepest pockets and the most urgency to experiment with financing new models through pilots and other things. You see a lot of out-of-pocket for things where patients are just tired of waiting. Like, let's say you want to use microbiome modulation to try to treat some of your autoimmune conditions like IBD. No one's going to pay for that right now. Absolutely not. But people are desperate enough because it's a bad enough disease and the alternatives are horrible side effects or surgery. They're willing to pay out of pocket, $500 to $1,000 to try to see if they can do something about this. So you're starting to see a bit of demand based there and self-pay. And when you have a critical mass of information, the data itself is monetizable to a certain point. So companies like IQVIA will be happy to have some information like this. Or you get to a point where you can finally make a case to say, hey, government, would you like to pay for this because it saves you money and improves the quality of your citizens? And we are starting to see companies that have amassed sufficient data where insurers and governments are actually paying. Even here in Asia, Health to Sync in Taiwan will be the first company that will have its digital therapeutic or SAMD reimbursed by the Taiwanese government, as an example. So, but that's all recent, and it's a 10+ year journey to get there. It's slow, so the order that we typically see, just to recap, is pharma plus some sort of consumer plus some sort of payer pilot, then broader payer adoption. Sometimes if you're doing something that benefits total cost of care, a provider will pay. Providers historically have been the hardest pockets to access because of the number of layers and the razor-thin margins.
So you made an interesting point there about the sort of the consumer side of stuff as well. I might get your thoughts on this. So if we're seeing a huge amount of digital health coming through the system, we're talking about influence in the healthcare system as part of this panel. And we're seeing the consumer making decisions about the type of healthcare they want or the type of data they want to collect to prevent this kind of healthcare anomaly that's going to happen in the future. How would you be open to a startup accessing the US first because of the size of it? Or is it more actually, let's test it in a different ecosystem, kind of get through the functionalities, the growth models, the challenges or that exist within the technology and sort of define it? Or is it your expectation that, no, we should go straight to the US first? How do you think through that as a LP?
Oh, yeah. Well, I have very strong opinions about this from just my former operations hat. So an LP, again, I'm mainly diligencing venture funds at the moment, and opportunistically we'll look at companies. I just looked at a health tech company last week, pitch actually. But I think people grossly underestimate when you're going to a new market how much it really costs. And even in the US, when you're trying to open up a new region in the US, it's cost, it's branding, it's awareness, it's having local people that understand the consumer in that local region. And I think it's important to understand, going back to kind of my first point, which is fragmentation in the US market, you can't just generalize US market as, oh, it's a US market, right? Within the US, there's many subcultures, are you going East Coast, West Coast, North, South, rural areas, and then all the regulation around not just nationwide, but within each state as well. So just interweaving sort of, various things that I mentioned before is, what is the company's strength, right? Do they have a true competitive advantage in a specific market? If so, start with that as well, considering all your tech and product advantages as well. You have to look at it holistically when you're entering a new market, in my opinion. So that, I always hate giving this answer of it depends, but it depends based on, I think, competitive advantage, right? Not just from a market standpoint, but your product technology. And you really have to map out what are all the roadblocks and how is your team specifically positioned to overcome those roadblocks better than anybody else. from a regulation, from an actual IP, from market advantage? Do you have connections, right? Sometimes all it takes is maybe one connection and one inroad that can get the rest of the market to adopt, right? And so you really have to go more granular into that specific company and understand what that strategy kind of to Chris's point, right? What's the strategy? What's the plan? And then can this team actually execute upon that? Yeah, so that's kind of how I would look at it.
But maybe really quickly, as someone who does redomicile companies and seek them to exit in the U.S., it is exceptionally difficult to start in a market that isn't yours. So unless you have some really unique deep tech where you can get to POC and then you're like, okay, we need real money, you have to succeed in your local market first. And if you're not solving something for your local market and you're in that local market, why are you in that local market? Move. Just like pack your suitcase, move to the US, if that's what you want to do.
It's an interesting, so I think slightly differently to that comment, actually, and I think it's okay. But Chris, from your perspective, how do you think about it? What are some of the pitfalls that you see with some of these startups that are looking to access the UK ecosystems, maybe the Cambridge, the London, the Manchester, the Edinburghs? What are some of the pitfalls that you see when they're looking to maybe use that UK as a second or third marketplace, and especially when they're trying to scale up? And just on that, what sort of support do you think they need as well that the UK offers?
Yeah, in the UK, well, from a support perspective, there is quite a lot of support. It's, as I mentioned earlier, it is highly competitive. So it's a highly competitive environment. So we have there is a lot of companies competing, if you talk about grant funding, so it is very competitive. The support available, if we talk about accelerators, for example, there are a lot of accelerators in the UK. There are hundreds of accelerators in health alone. There's probably well over 100. But what is really beneficial are the accelerators which are linked to the health system. For example, Digital Health London is one. NHS have their own NHS Innovation Accelerator. There are a number which are run with the Health Innovation Networks. So invaluable because it's so close to the healthcare system. So from an ecosystem perspective, that's hugely beneficial. I think one of the challenges is in the country is outside of the Golden Triangle, so that is a challenge. Other parts of the country, although with the HIN network right across the country, that is very beneficial for those companies that are spread over the UK. And then there are other networks outside of England, in Scotland, Wales, and Northern Ireland as well. So obviously, grant funding goes right across the UK. That's kind of the support which is really in place from the ecosystem.
So one question that's always bothered me, and it's around this grant funding concept. So when we look at organic ecosystems, we tend to find that the private market is very strong in helping early stage startups with early seed funding, et cetera, and really contributing to it. And then in more of the designed ecosystems, we see a much stronger grant funding concept. How do you feel the balance is on that? Do you see that the private funded startups are more effective because perhaps they get different capability and mentorship along the way? Or is the grant filling a gap where the skills don't exist and they're trying to push the agenda?
Can I kind of just come in on just kind of the expansion and kind of bring in the two together, so the investor part and grant funding, so as well as the accelerators as well. So a couple of things we've done is so we have a biomedical catalyst, which is a program we're running for about 14 years, and I think we've invested about 600 million through that program. But so it was focused on R&D, but we also identified that we could expand the program to provide additional support to businesses. So we also run an investor partnership program. So we've brought that into the program. So then we combine that investor partnership. So we have about 180 investors who are in the program. And so you combine the R&D part. So businesses who are looking to do an R&D project can also combine that with the investment commitment into the business. And then another stream that we've also introduced is an accelerator program. And slight difference with this accelerator program is it's really focused on that early stage business. So businesses are really at kind of pre-proof of concept. So what we found is that businesses are really good from a technical perspective. So technology, they don't really need any help from a technology perspective, but it's the system level skills which they're often lacking. So that what we're really trying to do is address some of those questions that, actually the questions, they probably don't even know what the questions are quite often when they go further downstream. So when they get to that point and they're trying to get to market, they're going, oh, I wish I'd known that before. If we can answer some of those questions before, hopefully that will speed up when they go to market later on downstream.
So it's a really inclusive ecosystem concept. And Joseph, from your perspective in Singapore, where perhaps it's not quite as inclusive, do you see that the grant funding ecosystem model works? Is it an effective model where the private market doesn't kind of play at all in the early stage startup system?
Yes and no. I think when there is a large enough market opportunity for what is being funded by the grant, and when you have the right people in place, it will work fantastically well. Because one of the challenges is that there is this general misconception, and I would say this in less mature ecosystems, that grant funding is a component of your valuation, but never is one questioning how efficiently or well spent or allocated that grant funding was. So a lot of the startups come out of the gate, maybe it's less so these days, but when the frenzy was happening, a lot of startups would come out of the gate pre-product with a $10 million pre-money valuation, and that was just a non-starter, especially for things that are not going to exit for $1 billion or 500 million or even 200 million. And for private capital to find something attractive enough, it has to be sufficiently de-risked where the VC math works commensurate with the stage that the private capital is investing in. And I think for some of these startups, the granting was kind of funneled in until it finally caught up. And somebody, and it was usually a corporate, not a pure VC fund that came in to support the company for the rest of the way. And there are some, I wouldn't say success stories because they're still being written, but I'd say some promising efforts. But at the same time, you also have these other grantosauruses, which are basically being kept alive, or zombie grant. They're grant zombies. That's the term that we use, grant zombies. And it's not unique to Singapore. You see a lot of this also in Western Europe as well, where companies they should have been let to die because it's clear that the private market's not taking it. But so much has been put forth into it. So many stakeholders have been aligned and are rooting for it that it just should be put out of its misery, unfortunately. Yeah.
And we've got 7 minutes left, but Kay, from your perspective, when we look at the US and then we compare it to Japan, perhaps. So the US has a very strong entrepreneurial, lots of grants coming in, lots of private market funding coming as well. In Japan, not so much, and you kind of mentioned this a little bit before. What are some of the gold standard elements that you see in the US that perhaps could be adopted in Japan and maybe pivoted slightly to work within the local system? But what really works, because Japan has incredible infrastructure, incredible capability, phenomenal technology, and Josie mentioned earlier that this risk failure thing is a scary thing. Perhaps we're not seeing as much of that mindset here in Japan. So how do we change that? How do we enable that here?
I have lots of thoughts, so I'll try to keep this short. I'll answer this in terms of the grant making in the US and maybe just talk a little bit about impact investing, since that is our mandate, especially in venture. So I think of the capital stack in terms of a spectrum, if you will. So you have grants on one side where you don't really expect a return, and on the far end of the other side, you have absolute returns like hedge funds, for example. The family office I'm at, we're LP investors in a couple hedge funds, right? And we invest across this capital stack. We also do some grant making, right, where we don't expect a return. And sort of in this evolution of impact investing, which is this notion where you can invest in companies and funds doing good and make money, right? It's not one or the other extreme. You have catalytic capital is what they called it, where people are looking for, maybe from grants from foundations or endowments where they're not expecting as big of returns. They have impact investing, where it's kind of somewhere in the middle, but you're still looking for returns. And that's kind of where my family office sits in our philosophy around impact investing, is we're looking for returns and we're looking to make an impact in people, a positive impact on people and planet. There are definitely grants, right, in the US from NIH and different government subsidies, and I think they're great. When I look at companies that have, think about cap table, right, non-dilutive grants, absolutely. There are grants on the table. I'm asking the founders, well, why haven't you applied to these grants? It's free money on the table where you don't have this expectation of making monetary returns. You don't have, listed on the cap table. It's effectively free money. And so why aren't you leveraging that with your company, right? Because the number one job for a founder CEO is make sure the company grows, but making sure you don't run out of money, right? And you have the runway in order for the company to be able to grow. I'm advising a AI medtech company in Japan coming into the US, right? And half of their funding so far is non-diluted government grants. And I think that's great because there's a lot of grant opportunities in the US and in Japan. And so I think it's definitely a mix. I think from an LP investor perspective, I actually have connections and meet with like the NIH grant giving folks and also other peer family offices to see who are my peers investing in. Working with a former hedge fund manager, the way I look at venture, it's very high risk, but it's always asking, how do we de-risk this investment for us, whether it's a fund or a founder? How do we continually de-risk? And I think one of the key elements in de-risking any deal is the community. And we, even if we write X amount of dollars, that founder or that fund manager needs to raise more money from other people. So it's not just our dollars going in, but how do we support and crowd in other capital as well? And vice versa, who are the other people in the ecosystem investing in, and how can we get into this deal to de-risk our own dollars as well? And so that's kind of one thing. And then quick thing, because I know we're running out of time. In the US, there's what's called a donor advised fund, or a DAF. And that is one of the biggest secrets, I think, unknown secrets. I mean, people know about it, but a lot of family offices don't leverage it. What does it mean? It's basically, you can get tax deductible dollars that you can invest in for-profit companies. I don't think we have time to go over it, but please search it, or I'm happy to discuss it later. The pros is it's basically tax deductible. Cons is you can't actually withdraw it, so you can't liquidate that capital to then buy a plane, for example. But it keeps accruing, and then you can actually use that as philanthropic dollars and use that as investable cash into for-profit companies or funds. And so I think that is one thing in the US I think there's something about, I'll say a couple $100 billion locked up in DAFs that aren't being mobilized or utilized, which is a huge opportunity to invest in things like healthcare, life sciences, biotech, to enable a lot of these innovations going around. So I think that is one thing that is big in the US that even I think US-based family offices don't really know about and aren't leveraging to the full extent that they can be.
Carl, I might just give you the last word on this. So to the point that we're seeing M&A on the rise and the importance of corporates in an ecosystem, how do you foresee the future of sort of corporates interacting with startups in this kind of new precipice, this new wave of health innovation and sort of affecting the healthcare system and the adoption? So where do Philips and other corporates fit in that game?
Yeah, maybe just to build up a little bit on what was mentioned before, right? So we need to think about those big corporations like Philips in two ways. There is the direct investment, right, with the startups, where we are looking to get a more niche, aligned with the portfolio, clear unmet need, a business case well-defined. The return of investment, it's in the top, right? So definitely we see a lot of dollars going into that channel. But also big corporations like Philips also have philanthropy, right? And healthier the company becomes, more dollars go into the philanthropy. And so there is also the benefit of the grants coming out of those corporations that can benefit small startups that are still in early stage of the development, looking for kind of get those funds for proof of concept and get a little bit more mature. The other aspect that I think it's important to kind of mention is that more and more we are seeing grants coming from governmental agencies that are pushing for private investment as part of the criteria, right? Because help us to dilute the risk and make sure that other companies that are big in scaling and looking for more return of investment, kind of investing a co-investment approach. So I think we need to look from those two perspectives. Companies like Philips are definitely partnering more and more, and it's part of the DNA with small companies, and are going to keep investing into those companies. But there's also the philanthropy that can help us to push the innovation in that early stages. So I think companies out there should be looking at companies like Philips from those both angles.
Amazing, thank you. So we're out of time, but just to wrap up, I think it's been an incredibly stimulating and interesting conversation. There's no magic bullet, I think, to the perfect ecosystem. And there's so many factors with respect to people, to mindset, to capability, to policy, to funding, to research. It all contributes to a uniqueness. And I think it's a really exciting concept to understand how different countries think about it and play to their strengths, or don't in some cases. So thank you very much for your expert advice, for your insights today. It's been incredibly stimulating and exciting. Please help me in thanking the panel this afternoon. Thank you.
Thank you, and let's not forget to thank our moderator, Dr. Palmer. Thank you very much.